significant business results coach and a co-facilitator with Fasttrac New Venture and Fasttrac Growth Venture. I'll be exploring by asking questions of entrepreneurs, how they got started, why they got started, what's working and what's not working, so that you, the entrepreneur, can learn from them. Join us as we start the entrepreneurial journey. I've had the pleasure of working with a number of entrepreneurs, folks who've decided that they're ready for entrepreneurism. And with me today is Dr. Noel Weeks Jr. He's an entrepreneur who's starting a nonprofit, and he's going to tell us a little bit about what he's doing and why he's doing it. What does it take to be an entrepreneur? On a personal level, do you need a lot of money? Do you need a lot of guts? Is it some combination of the two?
Basically, I'd say perseverance, number one. Mm-hmm. Perseverance is absolutely important. Money depends upon the project you're working on. With my project, I basically started out initially when I was not really sure how I was going to approach it. The budget was very large. But after going through my business plan and refining things, it's actually now I minimized the budget tremendously, and do much of my work out of pocket, but it's kind of bootstrapping it, as it were.
Okay, now, business plan, bootstrapping, less money? Wait a minute, all these things sound kind of inconsistent with what a lot of people think about entrepreneurship. Why did you do a business plan if you knew what you wanted to do?
Very good question. I did a business plan because, one, I was told I had to do one,
okay,
which is very important.
Good.
And then once I got behind that and said, okay, people kept mentioning it when I was taking courses at New York City's Business Solutions and at the Kaufman Center. They mentioned that this business plan is very important. It's not just the lifeblood of your business. It's a blueprint of how things get done. Mm-hmm. So basically it takes an idea and it formalizes a structure so you can see your business from different points of view, and you know how to respond to different things that come up because you know your market, you know what you are able to do, you know where you can find help. That's just it's a 360 of all the business that you need to do to make your business work. And
Wow.
That was why it was very, very important to get it done.
Well, I like that idea of a 360. So in having the 360, why did you end up projecting needing less money than you originally thought?
Because I realized, one, with the economy the way it is today is one thing, because I'm making my business a little bit different as an entrepreneur, because I'm working as a nonprofit, mm-hmm, which is a 501c3, which people can give donations to the organization, and the donations are tax deductible. But I find that with my project, it's just easier to go that way. But I find that keeping the cost low and the overhead low especially is very important, because basically other foundations or whatever, people look at your business and say, well, how much money is going to actually the program that you're running? How much money is going to the overhead? And when your overhead is too high, they're like, this person's not being effective with his money, not being effective with his time. And so therefore I have to go back over and whittle out things here and there. Which also meant too, as whittling out certain ideas and things I had planned initially, I got more real about what a business really is. And also got real too about the fact that, yes, you have to delegate certain authorities to other people, but there's different ways you can do it. You can actually go out and hire a lawyer, or you can go through a clearinghouse and get one at a lower price. Like, I'm very lucky that I got lawyers from SCAD and ARPS. I got them actually free, pro bono, through another service, the clearinghouse, because I have a very public service idea.
Okay.
So you look for those opportunities and you try to seek them out.
Okay, so you have a nonprofit.
Right.
So are you really an entrepreneur?
I consider myself a budding one, only because I've been through the process and I've actually taken several courses with the Small Business Association, also with New York City Business Solutions, and with Kaufman. So for the last 9 months or so, I've been very active in terms of what a business person does and what's supposed to learn its foundation. So I had that foundation in me. So I consider myself a entrepreneur, but one on his way.
Okay. So then I'm going to put you to the entrepreneur's test.
Okay.
And that is, for those of you out in the audience, you know that there is, in theory, this situation that every entrepreneur gets. And that is that they're in the elevator with person X and they've got 30 seconds to tell that person what their business is all about.
Right.
So we're going to start the clock, and in 30 seconds or less, tell us, what is your idea?
My idea simply is I want to take medical information and simplify it for patients so that they can understand it easier. And not just take the text of that information and make it easier, because right now text is at an 8th grade level in most institutions. I'm going to put it at a 6th grade level, at least. But also with that text, I'm going to add videotapes of patients who've also experienced the same diseases. And therefore they have a context where they can take the text and the patient's interviews and get a better idea of what the idea was, what's to expect, what's coming ahead of them and down the road when it comes to actually treatments, plans, which hospitals to go to, which clinics to go to. So therefore they get a better idea of how to take care of themselves better and take a proactive interest in their own medical care.
Do you have a tagline for your business?
Be healthy.
Be healthy. Okay.
Nothing simpler than that.
And what's the name of your nonprofit organization?
Health, Science, Education, and basically I think it says it all right there, HSE.
Okay. So when are you going to start this nonprofit? You've done the business plan?
Done the business plan, finish that up, and I'm just editing it in small details. But basically the next step for me is to file my 501c3 application with the government, because basically to get the tax deduction status, I need that 501c3 done, which will be done shortly. And once I get approval from them, then I can start my business officially.
So do you have a startup budget?
Yeah, I have a startup budget right now. Basically, it's, like I said, I whittle things down to basically less than $500 to get things started.
Did you say $500?
That's what I said, $500, yes.
$500.
Just to get it up, to get it right off the ground. That first, say doors open, say July 1st. If I have $500 in my pocket, I can get my business started.
Okay. Are you going to have investors?
Oh yeah, I mean I'll be looking for people to actually definitely take to get donations from. I'll be looking at foundations. I'll also be looking at we have some other. I met some people at the Kaufman Institute who came to visit our class, and they're working on different types of way to get donors and organizations together.
Is your service of benefit to the physicians or of benefit to the people who have the disease?
Basically, it's benefit to first and foremost to the patient. That's my critical concern. I care about them, and I want them to get the best help that they can get. Now, basically, for them to get that best help, they need to basically empower themselves. They got to say, okay, fine, I'm in this situation, I have this disease, I've just got diagnosed with this, whatever it may be. What do I do now? Come to my site, and I'll give you the information that you need to say, okay, this is basic information that I need now. Let me go talk to my doctor, and I can work with him or her and get a better idea where I go from here.
Okay, so what were people doing before you came up with this great idea? I mean, I'm sure there were magazines or people could talk with their friends. I mean, why are those alternatives not as effective as what you're proposing?
Well, one, there are definitely there are different sites out there that can use and different sources they can go to. What I'm trying to offer the patients right now is something which is simple to read and standardized. It's a full encyclopedia of medical information from each disease and from each perspective, and it's geared towards them and for simple comprehension. So to get the information they need for prognosis, diagnosis, for therapy, different types of therapy treatments, and also what to expect in terms of even your emotional content, what happens to you during the course of a disease which could be affecting you and your family. That's a little bit different.
Okay, now I know your website is coming up in a few weeks, but let's pretend the website's up. What would someone type? What's the website address?
The website's address will be healthscienceeducation.org.
Okay, so that's a lot of words and a lot of letters.
Right.
Will there be a shortened version
eventually
for folks that maybe don't spell that well?
I'll have to eventually make it a little bit shorter. When I find a appropriate domain to make it shorter, I will.
Okay.
Because I know that's a lot to remember. I mean, I call the company with myself HSE, but you just can't use HSE because it's already been appropriated by someone else.
Okay, so health, sciences,
education, health, science, education.
Health, science, education.
.org.
.org. Okay.
Right.
And so once someone types that in, what are they going to see on that main menu or main screen?
The main page will come up, and basically it'll be a very simple page, not too many distractions, not too many, flash things and things, just distract the pages from what actually needs to be done. First, you're going to see the list of diseases, and you pick which one you want to go to. I want the navigation from the page, from the main page to what you want to find specifically, be just that simple. So, I mean, through my research, I found that the three points of view which are very important for people who suffer from health literacy. One, they find it difficult to navigate different sites because they have to go through too much other nonsense or different sponsors or whatever. So I'll keep the page as clean as possible so they can get to where they want to go to. So 1 is the navigation, 2 is the simple language, and 3, people need visual input. It makes it easier for them to understand, to comprehend things. So I'm going to add, that's why I add the videos to this as well, which really makes my program different than anyone else's, of a full encyclopedia of medical videos given by patients to patients.
Okay.
And that's what, so that's why I'm saying quickly, a navigation. I have this disease, you can type it in, or you can find it through a alphabet chart, click it in, and then just keep going from there, and you get your information right away.
Okay. Well, thanks. I look forward to having you come back on the program and walk us through the website, perhaps a video, and then some success stories.
Thank you very much. I'd definitely love to come back. Thank you.
Great. Thanks. So with us today was Dr. Noel Weeks Jr., and his website is www.healthscienceeducation.org.